welcome everyone to our webinar today, Climate of Care, Prioritizing Rights to Health of Persons with Albinism in the Context of Climate Change. I have with me a wonderful panel of guests to really discuss an issue that has not been given the prominence that it really deserves, considering the harmful impacts of climate change on the health and other human rights of persons with albinism. Joining us today is UN independent expert on the enjoyment of human rights by persons with albinism, Ms. Muluka Miti-Drummond. She holds an LLB and an LLM in international law and a Master of Science degree in development management. Prior to taking on the role that she now has, she previously supported the first mandate holder, Ms. I.K. Ero. Welcome to you, Ms. Miti-Drummond. Our second panelist is Ms. Mafalda Soto Valdes. She's director of Beyond Suncare, an organization focused on health and dignity of persons with albinism. She holds a Master of Science degree in tropical disease and international health. She has been working on issues of persons with albinism in Africa since 2008. Welcome to you, Ms. Valdes. Next, we have Mr. Kwame Andrew Daklo. Mr. Andrew Daklo is the advocacy manager of Africa Albinism Network, a continental organization focused on advocacy and supporting the human rights of persons with albinism on the continent. Mr. Daklo is a disability rights advocate from Ghana. He holds a master's degree in human rights and democratization in Africa. And last but certainly not least, Ms. Marvelous Tshuma, who is the founding director of Noble Hands Trust Zimbabwe. Ms. Tshuma is an outspoken advocate for people with albinism in Zimbabwe. She also leads Albinism Connect Band, and in 2023, the band, which empowers youth with albinism, launched its very first album. Welcome to you, Ms. Tshuma. And now I'll hand over to our tech team to just show us a video produced by the Office of the UN Independent Expert on the Enjoyment of Human Rights by Persons with Albinism to begin to frame for us the important conversation we're about to have. I think the sound is not playing.
I'm Martinez, and my family have been living on these islands for 4 generations. As a child, I would go to the market with my family to sell our farm products. My friends and I used to spend hours playing in the forest, protected by the towering trees. But it's disheartening to see the trees shrinking rapidly as people cut down trees without planting new ones. I have noticed that without the shade from the trees, my skin gets burnt more often. Years back, the worst tropical storm season hit us hard. It flooded everywhere, destroying our farms and homes. The tents provided by the Disaster Relief Fund were very hot inside, so we spent more time out in the sun. The storm changed the terrain, and with my poor vision, it was hard to get around. We lost our livelihood to the storm and faced additional expenses, forcing some family members to seek work elsewhere. Recently, a sunburn refused to heal, and it was discovered I had skin cancer. I underwent a quick operation to prevent its spread. The clinic emphasized the importance of protective measures like long-sleeve clothing, hats, and SPF 50 sunscreen. Due to climate change, this is crucial as there is reduced forest cover and increased pollution. Unfortunately, people with albinism face even greater challenges in some African countries, where superstitions blame them for climate-related disasters and some are victims of violence. While climate change discussions are ongoing, persons with albinism have been excluded. It's crucial for countries to include us and conduct more research to understand how climate change affects us. UV-conscious urban planning and access to free sunscreen and skin cancer treatment are necessary to safeguard our health.
Thank you so much for sharing that video. And I'm going to turn it over now to Ms. Muluka Miti-Drummond to give us a few remarks and talk a little bit as well about a very important report that she released this year on climate change and persons with albinism. Over to you, Ms. Drummond.
Thank you, Sarah, and thank you to the organizers and to all of you who have joined today, this afternoon, morning, evening, wherever you are, depending on your time zone. I'm very heartened to see that people are interested in this very important topic. The issue of climate change is not a new area of human rights concern. It's not a new area of discussion. However, when it comes to the discussion on climate change and persons with disabilities in general, this is a new area. Persons with disabilities have been left out of these discussions, and those with albinism even more so. So it's quite heartening to see that we are now having these discussions and raising the concerns. As Sarah mentioned, my recent report presented before the UN General Assembly in October this year was on the issue of climate change and persons with albinism and the impact of climate change on persons with albinism, to be specific. It is clear from the research that was carried out that persons with albinism continue to be left out in these discussions. They continue to be invisible in discussions related to climate change. In fact, persons with albinism tend to be excluded in discussions around disability in general. And therefore, if persons with albinism are not included in discussions on disability, they're not going to be included in the very few discussions about climate change that impact their lives. And those are discussions around climate change and disability. From the research that has come out recently and in the past couple of years, it is clear that climate change disproportionately impacts persons with disabilities. Persons with disabilities are left out of climate change-related disaster management programs. They find that warning signs are inaccessible. They have the challenges of being separated from their support and from assistive devices, and the challenges of potentially getting more disabilities because of climate change-related disasters. These are concerns that impact persons with albinism as persons with disabilities. However, for those with albinism, the impact of climate change is even worse. But the main challenge for persons with albinism when it comes to climate change is the increasing UV rays. And this increase in UV rays leads to an increase in the susceptibility to skin cancer. As many of you may already know, persons with albinism, due to a lack of melanin, are very vulnerable to skin damage from the sun and from skin cancer. In fact, some research has shown that persons with albinism, particularly in African countries, where there are no other interventions in place, are unlikely to live beyond the age of 40 years because of skin cancer. Now, this skin cancer is not the only concern that directly relates to persons with albinism, as we'll see when it comes to climate change. Due to lack of consideration of these, their needs, lack of consideration of the specific needs of persons with albinism, including the need for access to skin cancer treatment and prevention mechanisms such as sunscreens and protective clothing. This is not taken into account when climate change adaptation strategies are being implemented and designed. We also have concerns related to violence and the increase of violence against persons with albinism. Violence against persons with albinism happens because of the misbelief or misconception that the body parts of persons with albinism can produce some kind of luck, wealth, or fortune. And unfortunately, during climate change-related disasters, there is an increase of vulnerability of persons with albinism to such violence. In addition, we have received reports that in certain countries, persons with albinism are actually blamed for natural disasters because people are unaware of what actually causes the natural disasters and are superstitious of albinism as a condition. So there are a lot of concerns, as we will learn today and hear more of today, that specifically impact persons with albinism, and yet they continue to be left out of these discussions. They continually are excluded from COP28, and it's good to know and encouraging to know that this time around we will have at least one person participating at COP28 on the margins of COP28 rather than the actual COP28. But it is important that we discuss this more, we start talking about it more, so that we start including persons with albinism in these discussions and taking into account their very specific needs. To finish, I just want to raise an anecdote that was raised when I had my country visit to Panama in September this year. Panama, as you may know, is one of the countries that is most impacted by climate change due to the islands around, the small islands around Panama. And the small islands, San Blas, also referred to as the Kunayala Islands, are actually also home of one of the highest populations of persons with albinism. Now, the San Blas Islands are sinking, and so strategies are being taken to move people away from the islands and onto the mainland. However, in preparing for this, the authorities started by cutting down all the trees in the areas where they're going to build these new houses for people to be relocated. Cutting down all the trees means removing all shade for persons who are moving to this area. And as I've said, the San Blas Islands have got one of the highest populations of persons with albinism. So in their climate change strategies, the states are in fact increasing the risk of persons with albinism being impacted by UV rays. This is why we need to talk about albinism and climate change, so that authorities are aware that their strategies have to take into account the very specific needs of persons with albinism. Thank you very much for this time, and I look forward to the discussion we're having today.
Thank you so much, Muluka, for those important remarks, really framing the issue. And I think for me, the key thing is exclusion, right? And so I'm going to turn now to Kwame to talk a little bit more about that. How is this exclusion in certain spaces impacted persons with albinism, you know, on the African continent, particularly where you work in the face of climate change? What has been the impact? Even in African forums, are they also excluded?
Thank you, Sarah, for inviting me, and thank you, Muluka, for setting the tone for this discussion. And my greetings to all those joining us here. Yeah, this is a great conversation that has to be done. I think it's long overdue for this conversation to be ongoing. And with regards to your question, Sarah, I think as of today, the inclusion of people with albinism, even disability in general, in climate change discussions or discourse have not been yet streamlined. They are always an afterthought. When people are gathered and they say, oh, there's no person with albinism or there's no person with disability in this conference. Then maybe they take that move or they just forget about it. But for us at African Albinism Network, even if you don't invite us, we are inviting ourselves to the table. So we've been pushing. For example, a specific example is on just on the African Commission on Human and People's Rights. We were able to send a young lady with albinism to present a statement on the floor of that commission, which was very strategic because we wanted to be visible. We want the person with albinism to be visible. And these statements contain issues of climate change and how it impacts person with albinism. And we've been doing this all across Africa, and now we are taking it to the international stage. So yeah, the conversation needs to happen. And even if persons with albinism are not invited, I think we need to strategically position ourselves to be visible. And that is very important for us to do going forward, so that the issues of climate change and albinism can be streamlined. You know, the issue is climate change. We don't have to even wait for extreme weather events or heat waves to happen before we are impacted by climate change. On daily basis, before I walk from the office to the car, I am already affected by climate change. On a very sunny day, or you think, oh, this day is very cloudy, it's very nice weather, let me go swimming. You get burned because there's extreme UV rays penetrating through the cloud, and you don't even need sunshine to get exposure to UV rays, because in Africa we learned that the UV rays are up and above even 10 degrees, and even as low as 7, they are still being affected. So it is very important that we get included in this discussion so people can understand from our perspective how we are impacted by climate change. Thank you.
Thank you so much, Andrew. And I want to turn now to you, Mafalda, especially to pick on the points both Muluka and Andrew raised around skin cancer, right? You've been working on the continent for many, many years, supporting persons with albinism. And I want you to talk a little bit about skin cancer, to talk a little bit about what is it that they need, especially now, if it's not even about the sunlight, it's just about the, you know, the environment in which they exist with rising temperatures. What then have you been doing, and what are some of the worries you have for the future if we continue to exclude people with albinism?
Thank you very much, Sarah. And thank you very much, the Honor Institute, for allowing me to be today in this panel. And yes, so far in the conversation, you have been repeated about the level of UV radiation, and I want to introduce a concept which I believe is important. And this is the UV index, which is the way of measuring the amount of radiation in a specific place in a specific moment. So there is and I'm sorry if I am becoming a bit like technical, but I think it's important to understand exposure. And this is ranking the UV radiation index is ranking from 1 to 11. 1 is the less risky, I would say, and the maximum risk is the 11. So the literature and the WHO says that above 3, there is a risk for the development of skin cancer. So we're talking about 3. So going to, for example, like our knowledge is basically in sub-Saharan Africa, where also there's a region with the highest prevalence, talking about region of albinism in the world. So rarely this UV radiation goes below 8 or 9, which is usually 10. So the risk of the exposure is extremely high. So we have that. We also have we have also another component, which is like the poverty, when we are talking about like more than in the countries where we work, like more than 70-80% of the people are living in rural areas. So that means living outdoors most of the part of the day. And another element is like in many of the of these countries, like they like above 50% of the people live with less than $1.8 per day, with the level of poverty. So you can imagine how difficult it is to access to some of the items that are essential to prevent skin cancer, which with all what we have said, the risk of the prompt development, the prompt onset is very high. We have literature. We need to develop more literature, but we have literature that says that below 30, 40, like is the expectancy of life because of skin cancer. We in Beyond Suncare, we have been working like formally. Beyond Suncare was established in 2017, but I was working in the field from 2008, and we have in our database more than 4,000 persons with albinism, and we rarely have in the different communities and countries where we work, like I would say like 80% of the beneficiaries of the programs are below 40. So the experience is aligned with this data that we have, even though we have to produce more. So it's evident that there is a higher risk, and there are also other companies like poverty. And then there are the other element, which is very important, is the lack of awareness that is transversal. It's not only in the communities, not only in the families of persons with albinism, but also it's transversal to the institutions. Like albinism is not included in the curricula, in the university curricula. So there is a lot of lack of awareness of capacity to deal with like the lesions, the pre-lesions, because skin cancer is not something that appears from one day to another. It's a result of being exposed for many years, and there are precancerous lesions that can be treated. But if this knowledge is not there in primary healthcare, or because also another element that is aligned with the lack of awareness and aligned to the lack of funding or allocation of budgets, and it's the specialists in health that are dealing with skin cancer are dermatologists, and the number of dermatology consultants is very low. I just put a couple of examples. I started to work in Malawi in 2008, and there was no, for almost 20 million people, there was no consultant dermatologist in the country. Nowadays, there are 2. And in Tanzania, I moved to like consultants, there are 2 working. Then they have other specialties, but as consultants, as we understand, there are only 2. And in Tanzania, I started to work in 2011, and with more than 45 million people, there were three dermatologists, fully trained dermatologists. And also when skin cancer, when it evolves at the end, like the treatment, it has to be treated with radiotherapy. There is 1 center in the country. So you get like the possibility of the treatment and the management is very difficult, and also is unaffordable. unaffordable to the majority of the people. So we believe that we have to start with the prevention, which is, is much more cost effective, is less dramatic. So the working in prevention is always the best treatment. So this is where Beyond Suncare, the organization that we work with, is focusing in firstly in building the capacity and working towards the strengthening of the institutional systems, and putting the focus not only in the specialists but in the health workers that are in the rural areas, because as we say, like the 80% of them mainly live in rural areas. So centralization is not the solution. So it's important to decentralize and build the capacity and strengthen the institutions working at grassroots level. So so the education starts there. So this is where also Beyond Suncare is focusing in promoting the access to social health services. And with this focus on institutional strengthening, also the sunscreen. The sunscreen, as we say, is a very important element, and it's recommended to like the sunscreen with SPF 50, not lower than SPF 50. And you can imagine that also the accessibility to these products is very complicated. First, like because of main looking, I'm always sorry if I am a bit focused in Africa, but this is where we have our experience, and the challenge is big there. But in the continent, most of the people are very pigmented, so the market doesn't need to to put the efforts in manufacturing, in selling. So most of the sunscreen that are in the market are imported. The prices are very high. And also in other places,
so
there are
Mafalda, sorry to
donations.
interrupt you. I think you raised some really good points that I also want to like zero in on a little bit. And I want to turn to Marvelous Tshuma to talk a little bit, and we'll circle back to you because I think you raised some key points about production, local production, cost, and those are key issues that are important in part of any climate response on the continent. But now I kind of want to turn to Marvelous. There's a lot of things that I think Mafalda raised that will resonate with you in your own context. Things like, people with albinism having low life expectancy, dying before 30, dying before 40. Things like persons with albinism having lesions, not knowing what they are, living in rural areas. Can you share your own personal experience in supporting the different communities of persons with albinism in Zimbabwe? What have you seen on the impact of climate change, especially for skin cancer? What has been your experience as an activist on the ground?
Thank you so much. I'm very honored to be with you guys and discussing such an important topic. So I think people have got that misconception of thinking that people with albinism, they don't die, they disappear. Sometimes they don't reach the age of 50 or what. But what's there, it's because most of people, like here in Zimbabwe, I can say 80% of us spend our times in the sun because we are self-employed. We don't, like most of the times we'll be in the field, especially in the rural areas, they'll be in the fields doing those works on the sun. So when you have got cancer or when your skin, maybe sometimes your skin, you get burnt by the sun, then your skin starts developing some wounds and that cancer thing. It's the thing that is killing our people with albinism, our brothers and sisters with albinism. So what is killing us now? People will be thinking that, no, these people, they've got wounds, their skin is what. But what is killing us mostly is cancer. Because some of us, in fact, students, those kids who are in the rural areas, they go kilometers going to school. So sometimes cancer catches them while they are still young. And to reach the old age, they don't reach that age because they'll be suffering from cancer. Sometimes they get burnt and then they go to the hospital. The hospitals, they don't even understand how to treat those small wounds.
Okay, we've lost Marvelous there. I think when she comes back, we can have her continue. But again, she reiterates this important issue. And I think when we're thinking of humanizing the situation of persons with albinism, understanding that there are people whose lives are deeply affected, you know, by climate change.
They will say, no, buy this, buy this, but not helping. So the main nation from our families.
So yeah, she raises an important point I was saying about children walking to school in the sun. And I think that's a really stark picture in my mind that really should put urgency in governments to act. So maybe I'm going to circle back to you, Muluka. You've been going around to the different countries. Are there any best practices? Are there any sort of good things that you've seen where countries, whether they're low resource setting, and maybe that would be a great example, have been able to respond in some way and build the resilience and protect the health of persons with albinism?
Thank you so much. You're right. A lot of what Mafalda has raised and Marvelous has raised is setting the picture. As Mafalda said, sunscreen in many African countries is out of the reach of most people, including persons with albinism. And I currently live in Zambia, so I want to give an example, a concrete example of cost of sunscreen in Zambia, so we know what we're talking about. A minimum wage in Zambia is about 1,200, even less, you know, at times. So 1,200 kwacha a month is the minimum wage. The cost of sunscreen in Zambia is anything between 400 and 500 kwacha. So I'm talking about sunscreen with UVA, UVB, and SPF 50. And person with albinism may need two bottles of sunscreen. So we're looking at a minimum of 800 kwacha a month, with a minimum wage, if you are lucky, of 1,200 kwacha a month. So that's two-thirds the salary gone on sunscreen. And we need to consider that the same person has to pay, you know, school fees or bills and food. And if you have to prioritize eating above sunscreen, it's an obvious choice. People will do that. And this doesn't even speak to persons, families where maybe there's only one breadwinner and they may have 2 or 3 children with albinism. It's impossible for a family to be able to afford sunscreen. So what are the good practices in relation to this? We've seen countries where sunscreen is being provided. So national action plans are being set up. And in terms of the national action plan, sunscreens are being provided. Sunscreen is being provided by the authorities. Malawi is one of those countries where sunscreen is being provided. I want to recognize the work of Mafalda, you know, with Beyond Suncare, as well as Standing Voice and Pierre Fabre Foundation, who are carrying out projects within African countries to produce and distribute sunscreen. And I believe as well, you know, Marvelous, your organization is doing something similar or trying to do something similar in relation to distributing sunscreen. These are good practices that need to be replicated because we need to understand that for persons with albinism, sunscreen is basically an assistive device, even though it is not a device. You know, it is something that is essential. It's a matter of life and death. And states have an obligation to provide this kind of support to persons with albinism. Some countries may have social protection programs, which don't necessarily provide sunscreen, but they provide some kind of financial support, which alleviates financial burden and therefore frees up some funding for persons to buy sunscreen. As well as awareness raising campaigns. I think it's very important to have these awareness raising campaigns and education campaigns. So the work of Africa Albinism Network and a lot of the local albinism organizations in educating the authorities, educating schools as to the importance of sunscreen, as to the importance of maybe scheduling your PE activities at a time when it is cooler for children, taking into consideration that you have children with albinism at school. Nobody really should be running in the midday sun and exposing themselves to UV rays, but obviously not for persons with albinism. So organizations that are going around educating schools, educating the authorities, raising awareness of the need for sunscreen, and definitely national action plans, which I know Kwame can speak to a lot more because that is the work that African Albinism Network does.
And I just want to turn to some of the questions as well that we have in the chat. And I think, Muluka, this question will be a good one for you to respond. Kwame, you can come into, I do believe, to Muluka's point, you're doing some advocacy around this as well. So the question is, I believe that WHO via UTSS and Beyond Sunscare and Standing Voices have turned down the request to supply sunscreens for PWA. So they're saying basically there's been a request that's been turned down to supply sunscreen for PWA, although they've acknowledged that sunscreen, hats, and long sleeve are needed, plus advocacy. So the question here is saying, where do we go from here? So Muluka, maybe you can frame and explain a little bit what this is about, the background, and then you and Andrew can both speak to the where do we go from here point.
Thank you. I see the questions from Sylvia. Hi, Sylvia. It's nice to have you in the webinar. Sylvia is always following the work that's being done around this. It's good to see you here. Yes, Sylvia, you're right. So what happened was that in December last year, the Global Albinism Alliance, myself, Mafalda's organization Beyond Suncare, PF Fabre Foundation, Standing Voice, I believe that's everyone. I hope I haven't left out any organization. Oh, yes, Global Skin as well, and the International League of Dermatological Scientists. We made an application to the World Health Organization to have sunscreen re-added, and I have to say re-added, to the list of essential medicines, so the WHO essential medicines list. So prior to 2005, there had been sunscreen, or as the WHO had phrased it at the time, UV blockers added to the list of essential medicine. And this included things, I can't remember everything, but such as like zinc, which I think later was removed because, zinc oxide and things that will help to block UV rays. So we made an application last year to have this re-added. And we were advised at the time that it's better to start with specifically for persons with albinism and other persons who have similar conditions that make them susceptible to skin cancer. So it was XP that was specifically mentioned. The decision was taken by the WHO in July, if I'm not mistaken, this year. And unfortunately, the WHO this time decided not to add sunscreen to the list of essential medicine. However, we can also see it slightly positive in the sense that the WHO recognized that there is a need for sunscreen and the importance of sunscreen for reducing skin cancer and the incidence of skin cancer, particularly in persons with albinism and persons with XP. They recognize the public health benefit of UV, using sunscreen, especially when compared to the public health cost of treating skin cancer. However, they required further information from us on what would be needed, how we could distinguish between therapeutic sunscreen and cosmetic, what they call therapeutic sunscreen and cosmetic sunscreen. They also wanted further information on what would be the specific ingredients of sunscreen. So for us, this is not the end. I mean, it was a blow. It was disappointing that we didn't get sunscreen added this time around, but these are applications that can be made every 2 years. And I see that the response of the WHO provides us some leeway to understand what might be needed, what further information we need to add to a renewed application in 2 years. So we'll definitely be applying for the additions. We'll be searching for further information to add to this. So, I'll take this as an opportunity to make a request on anyone who understands sunscreen better than I do, because admittedly, it's not my area of expertise to provide that information. But I also think it's important for us to have some advocacy. I think, again, the importance of sunscreen for persons with albinism during climate change as well, in this day and age where everyone's talking about climate change. And in fact, actually, the importance of sunscreen for everyone. It should, persons with albinism even more, but all of us should be using sunscreen. And I think that needs to be taken into consideration. And we need more advocacy. We need more voices. And I suppose when we did this first application, even though we did talk about it a bit, it was almost done quietly. So I think if we have more advocacy between now and 2 years' time from now, when we have to apply, and we have more organizations calling for this and pushing for it, I think that would really help our application going forward. So another request for organizations and individuals to also join in this advocacy for the call for WHO to add sunscreen to the essential medicines list.
Wonderful call to action there. And so I'm going to turn to you, Kwame. I also am just going to weave in a follow-up question that's connected. So a participant says, what can we do to incorporate the recommendations that we make about protecting persons with albinism into policy? For example, can we ensure that sunscreen on the essential drug list is procured at the government level? So can we do something at the national level in the meantime while we're waiting for the very essential and very important action from the global?
Yes, thank you so much, Sarah. And I must commend to Muluka and the team who made that application to WHO. I think now we are clear on what the demands are so that sunscreen can be added to the essential medicines list. But coming down to the national level, I think our work around the National Action Plan on Persons with Albinism in Africa, I mean, our implementation of the AU Plan of Action, I think most of the recommendation we make is about at least making sunscreen available to persons with albinism. And we can speak about what we call the Kenyan model. They started providing sunscreen to persons with albinism even before they are now putting these policies on paper. They are now developing the action plan. So this is a very good example that even without WHO's intervention, countries can take the initiative, can take the step of protecting their individual, their citizens. You know, all of us, though WHO is an international organization, is just sitting at the top for advocacy purpose to motivate countries to take action. But countries can take action and then tell WHO that, oh, this is right for persons with albinism. So you don't even have to ask for it. We are doing it ourselves, whether you add it or not. That is what we are doing as African Albinism Network. So in any national action plan that we are developing, we ensure that sunscreen is included in that action plan and government is tasked to provide this for persons with albinism. Kenya is an example. To some extent, South Africa is doing that. To some extent, Namibia is doing that. To some extent, Zambia is doing that. I think Muluka can speak more to that. And to some extent, Tanzania and Malawi. And Mafalda's work is great on local production of sunscreen. I think I've had conversation with Mafalda as to how we can also produce sunscreens locally. Myself and my colleagues in Ghana, we know how to produce sunscreens locally using the local materials and some other few ingredients. So these are steps. This should be our advocacy point. We should, as citizens of various countries, we should begin to talk to our government that this is doable. Others are taking the lead. We can take an example from them. We don't have to wait for who to tell us what to do. We can do it ourselves and tell them that this is doable, and it's very important for persons with albinism to be protected in the country, because skin cancer kills. If we are not protected, we die even before age 40. A child as early as age 1, you can see visibly the scars and the destruction caused by sun. So this is very important that at every advocacy level, we mention sunscreen. Today, I was in a meeting with a group of founders, and they are concerned. Why is person with albinism always asking about sunscreen? And I told them that no, it's very important to us, because if you put, say, Panadol and then sunscreen side by side, I'll go for sunscreen because I don't need Panadol every day. But I need sunscreen. I have to apply sunscreen 5 to 10 times a day before I can survive. Anytime I walk out into the sun, I need to apply sunscreen. So sunscreen is very crucial to our very existence. Aside from food, sunscreen should be less for persons with albinism. And therefore, it is very important that it is always on top of the list for the basic needs of persons with albinism. Once we have that on top of the list, I think we are preventing skin cancer up to about 90%. Yeah, that should be it. And this is very crucial, because I always say the normal say is prevention is better than cure, but I will always say prevention is cheaper than cure. Providing a bottle of sunscreen at least a month, it's cheaper than going for chemotherapy, which is even more toxic and can kill that person in 2 or 3 years. So sunscreen is very important, and then we can do our advocacy at the ground level, talk to our government, talk to our National Insurance Health Authority, speak to local governments. They can procure this, and also we can invite people like Mafalda to come to our countries to convince our government to set up the production line in these various countries. It's not only Mafalda. Muluka mentioned Pure Foundation and other organizations that are doing it. We can do this locally so that we protect ourselves from the ultraviolet rays that are coming from the sun. Thank you.
Thank you so much. And Mafalda, I want to turn to you also because there's talk of local production here. And I think when you first started your local production on the continent, that must have been a mind-blowing thing. So can you talk a little bit more? Is that the future of supporting effectively persons with albinism and their health right?
Yes, like I would say yes. I would say yes, but we always have in mind the issue of sustainability. You know, the proof of concept we had in Tanzania, which I mean, it was it was a pioneer work. Like we were just starting everything, and the cream, both the cream, the formula, and also the facilities were registered in the regulatory board in the Tanzania Foods and Drugs Authority. So we were breaking a lot of glass roof because it was the first time we were doing a lot of things. But the issue here is the sustainability. At the end, it was a donor-funded thing. So and now we are working in. Actually, we are present in 4 countries, and there is always, the call. It sounds very attractive, the fact of establishing a local production unit, and we have all the expertise and the know-how. And for us, even though it can sound exotic, for us it's not very complicated to set up because we have all the know-how. But the issue here is the sustainability, and we believe that governments have a strong role to play here. And our fight, for example, in Malawi, countries where we are, is like, if there is a budget allocated for the procurement, we have this model, which is not only doing locally, but also our goal is to prioritize the hiring of persons with albinism in the production unit. So you can also promote the social inclusion. And also we have developed a formula, a sunscreen formula, which is a very high quality, but very uncomplicated manufacturing process, because like the manufacturing, like the issue of maintenance, so it's very unsophisticated, so is very manually. So you can also hire people that don't have high high degrees in chemistry. You need a chemist or a pharmacy, but it's a lot of manual work. So that's our focus. But once again, going back to the sustainability, we believe that there is a lot of advocacy to create more awareness in governments, so they also prioritize on this. We have come across governments that currently they are procuring sunscreen, but the distribution model is not working, because they procure it centralized in 1 or 2 storehouses. But then from the districts, they are not aware of that, and they don't procure, because also when they procure, they are given a budget. And okay, if I produce sunscreen, then I remove a part of my budget, and I don't have a budget to buy paracetamol or to buy lidocaine. So that's another thing to build awareness and promote the knowledge among the institution. This is one of the legs of Beyond Suncare, like build the capacity and empower and strengthen the institution, so they are aware of that, so that they can prioritize, as such it happens you were mentioning about Kenya, about South Africa. And also another element that I want to bring to the table, and it's aligned to all what Muluka was saying about the application to the WHO, is the quality of the sunscreen. And this is also something that for us is very worrisome. Sunscreen internationally is considered as a cosmetic. So when you develop a drug, it has to go through preclinical and then clinical trials, phase 1, 2, 3, 4. So even though with that, there is an issue in many African countries of fake drugs, but as at least we have, some regulatory issue there with the preclinical and clinical trials. This doesn't apply to sunscreen. So many of the sunscreen you find in the market, there is no test of SPF. They put approximate numbers, and when you do take a sample and you do a SPF test in vitro or in vivo, you are surprised. We have come across that, and we have presented reports to governments, because they were distributing through health centers a sunscreen that it was stated SPF 30 or 50, and it was really not reaching even 15. And that's a huge problem, because you're distributing to the people, they apply and believing that they are very protected, so they are safe, and it's not. So another element is the quality, and and these governments, because of the lack of prioritization and awareness, and also they are not experts on that. So I believe also an element, and this is also, I believe that when the outcome of the WHO was there, it's also aligned with that. Yes, we can include the sunscreen in our list, but how can we ensure that that sunscreen is really has really the performance, both in safety and also in efficacy? So that's another element that we bring to the table and makes things a bit more complicated. But we also have to think on that, the quality and the safety. Are we really protecting? Because usually the budgets of these governments is not high, so they go to the cheapest product. So but a sunscreen that costs 2 or 3 euros, it's impossible that has a SPF of 50, because filters are very expensive. So that's another element that I bring to the table, and that we have to consider when we are thinking about distributing sunscreen. It has to be a good, safe, and efficient product.
Thank you so much for that, Mafalda. And talking about this false medicines or fake medicines, so many of them, right, that are affecting then health. Muluka, why don't you come in? And then Marvelous, I want you to prepare to talk a little bit about, in Zimbabwe, what has been your experience when people with albinism cannot get access to sunscreen? What then are they forced to turn to? But first, Muluka, please go ahead.
Right, thank you so much. And I think just listening to everyone, it just reminded me about the human rights aspect. So my title is very long, and part of that title is human rights, enjoyment of human rights. And I think it's important to highlight this, because we have to remember that when it comes to human rights and human rights treaties, the state has the number one obligation to ensure that people are able to enjoy their rights, and to put in measures, and put in measures to make sure that people are able to enjoy their rights. So with, local production is right, but we also need to look at other options and other things that the state can do, tax exemptions, to products. So sometimes we do have manufacturing companies who want to sponsor and maybe donate sunscreen, but then they're hindered from doing this because of custom charges and other tax charges that just make it impossible for them to actually donate these products. So states can consider that as well. Even if you don't want to add sunscreen to essential drugs list, can you at least in a way, make it easier for people to procure through tax exemptions? And like what Mafalda said is very important. Like the International Convention on Economic, Social, and Cultural Rights talks about the right to health, and it needs to be available, accessible, adequate, of good quality. It can't just be anything. We need to make sure that it is good quality. And I also want to just remember that when we look at the Convention on the Rights of Persons with Disabilities, the state is also obligated to have to mobilize resources. So resource mobilization. Yes, sunscreens can be expensive. Yes, they have other things that they need to also pay, but they can also mobilize resources, financial, technical. It's a variety of resources. And when we talk about resources, we're not just talking about money, but even expertise, the technical resources, people who can come in and, as Mafalda has done, teach people, how do we make local sunscreen of good quality? How can we reduce costs somehow to bring in sunscreen and the like? So I think it's always important that we also consider this in the context of the human rights treaties and the state's obligations, and not just the Convention on the Rights of Persons with Disability, but all conventions. And also bearing in mind that sunscreen makes it easier for people with albinism to participate in society. And so it's essential, because that's also a duty of the state to ensure that people can participate. And then I just quickly wanted to say, yes, the issue of quality is a big concern. There are places where authorities are providing sunscreen, but these are sunscreen sometimes of very low SPF, sometimes just UVA, no UVB. And the states will be happy because we're providing sunscreen, or there's a break in sunscreen, that people are provided sunscreen and then do not have any access to sunscreen for 5 months, 6 months, which also causes problems, because you develop the habit of going out as if you've got sunscreen, and then suddenly it's harder to push back and have behavior that will prevent without sunscreen, or that will help. So I think a lot of what is being said is very essential, and we need to consider this within that context.
Thank you so much, Muluka. Marvelous. I know that, Noble Hands Trust Zimbabwe, you try very much to distribute sunscreen lotion to as many members and communities as you can. But, you know, resource constraints are very real. You know, Mafalda has mentioned taxes and how a lot of countries have not done tax exemption. The issue of cost is something also that Muluka has mentioned. What then do persons with albinism do in Zimbabwe if they don't have access to sunscreen? What other measures are there? How do they respond? How do they try to protect themselves, whether it's, you know, the right thing to do, or, you know, what is their response mechanism to lack of sunscreen?
Thank you so much, Sarah. So here in Zimbabwe, like now the temperatures are very high. And for example, yesterday I just told myself, no, I'm not going to use sunscreen today because I'm indoors. It affected me so much to an extent that in the evening I had to put some after sun lotion to cool my face because I felt the heat. So here in Zimbabwe, most of people, especially in the rural areas where we are helping mostly, those people, they are using some they are using paraffin. Some they are using, there's a wild fruit which we call matamba in Shona. Some they don't use anything because I think there's somehow a lack of awareness in our community as people with albinism. So some they don't know about sunscreen lotions because they are in the deep rural areas. So they are using those things not knowing that they are damaging their skin. So right now, us in Zimbabwe, we are working with the National University of Science and Technology to come up with a suitable sunscreen lotion for our climate, because we've been using some other sunscreen lotions, affordable ones. Some sunscreen lotions are for you guys when you are coming out of the swimming pool, just to, you know. So for us, sometimes people with albinism, they don't afford those ones. They just buy those for $3, but the recommended one, SPF 50, especially the Nivea one, it's $22. The bottle that will maybe take you for a long time. So it's difficult for them to access sunscreen lotions. And most of the times when they develop cancer in the hospital, our hospitals are not functioning well. So sometimes they'll be saying, no, go to a private hospital and you are not even working. So this heat is affecting us so much here in Zimbabwe, and we have got no way to run away. So us as organizations, I'm so happy that we are here together to help each other out, to help our community as organizations. Thank you.
Thank you so much. And just to give the English translation for Matamba, it is the monkey orange tree. I think it's common within the region, so I think people would know what that is, just for the rest of our panelists. But I'll turn again to the Q&A, and also panelists, please, if you see any question that you feel that you can answer, please just go ahead and type your answer, because we have quite a few very good ones that are here. I'm going to try and go to one that I have not yet read out. Is there an alternative source of support in the absence of government support? Maybe this is more of maybe Kwame and Muluka, you can talk a bit. Where the government fails, what else is there? You've talked of PFI, you've talked of standing voices. You know, are they able to step in? The need must be insurmountable. But so I'd like to hear from you.
Yes, sure. Sarah, I think in the absence of government support, which is always the case, the alternative is to fall on CSOs and other partners for support. That is, and governments, either they drag their feet or they just totally ignore the situation. So we also have to always be on the lookout for alternative support. How do we talk to funders? How do we approach donor organizations to support the production? How do we approach maybe research institutions like Marvelous mentioned? They're working with a university to help them come up with formula for sunscreen. I've heard that before. In Ghana here, we also work with a university in Czech Republic, and just 2 students were able to formulate the sunscreen that they came and taught us how to produce that locally. So these are the alternatives you can take to be able to augment government efforts. Government priorities are very huge, and sometimes they tend to ignore the least ones. Mostly when you approach them, they ask, how many are you? And we don't know, because you are the government. You're supposed to know the number of citizens in your country, but you're asking the citizen, how many are you? How do we know that? You see, so sometimes we need to take the action first and then send it to government. Government, this is what you have done. This is we need your support. And so the challenge should not be for CSOs like the organization of Mafalda, who is facing issues of sustainability. You know, once these are introduced, government can take it up. Yeah, let me support you 50% or 80%. Take the rest. Then production continues, and then these are distributed to persons with albinism. But yeah, it needs a lot of talking, a lot of engagement with the government officials. We need to make friends with government officials. Let them understand our situation so that we can take that legacy from them. Thank you.
And I think I'll just jump in there as well. So in the absence of government at the moment, as Kwame has said, the donor organizations, philanthropic organizations, there are pharmaceutical organizations that might be willing to support as well. There's also the need for people to understand, you know, what kind of prevention behaviors they can take. So we can't rely always only on sunscreen. Long sleeves clothes, hats, umbrellas in the sun. This also helps reduce the risk. But at the same time, I also want to highlight that, yes, while we're not just going to sit back and, you know, and do nothing because government's doing nothing, we also can continue to push government to do something. And so advocacy is important. Continued engagement with authorities, dialogue with the authorities, research. So as Kwame mentioned, research organizations are also important because they produce the data, the information that we can then use to advocate the government to show that, you know, this is irrefutable proof that this is needed, that we need to take action to prevent deaths. There are a number of other advocacy avenues when you look at human rights, apart from dialogue and advocacy and speaking to parliamentarians and media action, because I think it's very important to also to use the media and raise awareness through that and other public awareness mechanisms. Courts can be used as well. You know, I mean, people are reluctant to use courts, but strategic litigation is one of those things. Governments have signed human rights treaties and they have made commitments on the basis of human rights treaties. Governments talk about the Sustainable Development Goals. The Sustainable Development Goals have a number of goals on health and equality that relate to persons with albinism, and we can use this as well. And, you know, there are national courts. There's a Committee on the Rights of Persons with Disability, communications to them. There are international and regional courts. If we need to get to that level, it's not something that we should you know, civil society should necessarily shy away from. And I think it's also important because sometimes we get overwhelmed by what we see as failure because we're always looking at the big picture. And it's important to look at the little picture, the small successes as well. And I think I will use Zambia because I'm in Zambia. Recently, there was a big scandal around someone being awarded a huge amount of money from a government official, awarded a huge amount of money as compensation. And part of the uproar in response to this was government is saying that they do not have money for sunscreen for persons with albinism, but the government can afford to give this unreasonable compensation. To me, it was a successful thing because this was somebody who was not in the albinism movement, who has not really interacted with albinism, does not have albinism themselves, but they realize the importance of sunscreen for persons with albinism. And they're highlighting this to say government is misusing resources, and instead of channeling it to very important issues such as this, they're channeling it to something else. So I think, you know, it's important to see that we are making progress. Yes, we've got a long way to go, but it's also useful for us to also see the progress that we're making and take heart from that and know that if we continue, we will hopefully succeed in what we want to do ultimately.
And there's a question here about, you know, could the International Society of Dermatology be an ally, specific research or journal articles? It seems that this compelling area, this area needs empirical research. So I don't know if you can also talk a little bit about, has that been done? Are they an ally? How have you been using that space to continue to push?
So yes, they are allies. They were, sorry, I'm assuming we're talking about the International League of Dermatological Scientists. Yes, and they were actually part of the application to the WHO. And they are also having their own call for action around skin cancer and sunscreen, which is coming up. So there is work being done around that from their point of view. And it's important because we need a multi-sectorial, multidisciplinary approach. In my approach is human rights. We need scientific approach as well. We need a variety of actors to work together. And through a holistic approach, we can hopefully make the difference and make, things move in the right direction.
And then this question, I think Kwame, Mafalda, Muluka, or Marvelous can answer. These are questions, I think, from people with albinism who are on the conversation we're having. So one colleague from SLAPWA, which is Sierra Leone Association of Persons with Albinism, says, how can we work on a project to have a global summit on climate change and albinism? And then Nadia from Togo says, it's so hot these days, so how do we know that we are using very good sunscreen? And then the last one I'll share for now is from Nene Basi in Nigeria, who says, persons with albinism here are seriously dying in their numbers. We need help. What do we do? So these are 3 questions from different parts of the continent about this issue. And I'll leave it to panelists to just pick whichever question you can answer more than once.
Yeah, sure. Starting from Sierra Leone about Global Summit on Albinism. Yeah, that required a huge funding, and which is the problem we have with funding of activities related to albinism. Maybe Muluka can take that up. So Muluka, that's actual call for action for your side. I don't know what we can also do to support, but yes, the African Albinism Network do organize pop-up learning forums in various countries. So this might be of interest to you to attend any of our pop-up learning forums that we organize. We do also organize forums of this nature, like what you're having today, co-hosting with O'Neill Institute. So these are also important that we can join. We can also join other conversations. Yeah, we don't necessarily have to wait for a global forum to start the advocacy on albinism, but smaller ones are even more impactful than the bigger ones, because this one, people just go take photos and showcase that they are in forums. But the smaller ones are more important than the bigger ones. So we should rather be thinking, as we think globally, we should also think locally, like to ensure that things are done in our local level. Maybe you have learned something from here today, you can take it to persons with albinism in your community. 3 or 4 of them you can discuss with them. Oh, this is how you protect yourself from effect of climate change. Don't always make sure you wear long sleeve, wear brim hat, something like that. This is the petty things we can do to support our own community. Once others are failing, we can do it ourselves. And on the question of, I forgot the trend of thought. So maybe sorry, I could just
yes.
raise it again.
I can repeat for you. So one of the questions was also, how do we know the right sunscreen to use? We're in Togo, it's very hot here. And then the other question, or really, it's a call for help to say, persons with albinism in Nigeria are dying. What can we do? Those are the other 2 questions.
Okay, so for the sunscreen, it's very simple. When you look onto the bottle, the first thing you should see is +50. Once you see 50 SPF or 50 plus SPF, that should at least. Then if you want to look deeper, then you have to look for UVA or UVB. So those are the things you need to look out for: UVA, UVB, SPF 50 or 50 plus. From that range, you should be good enough to protect yourself at least 90% of the time once you apply it. And protection, I mean, for persons with albinism, it's not only in Nigeria. I think Africa-wide, we are dying of skin cancer, and our government seems to be silent on that. But what can we do? First, we need to just protect ourselves. We need to take responsibility for our own selves. That is very important. Protect yourself, tell a friend to protect themselves, which is very important. Because if you are waiting on governments, you die and government will not even come to your burial. That is the truth. So the best thing we can do to protect ourselves from skin cancer and from dying is just to have maximum protection, wearing the long sleeve clothes, wearing the wide brim hats, wearing the protective sunglasses. And let me just put this, though it may not be therapeutic enough, but shea butter, which I think is available in Nigeria, has at least up to 15% sun protection factor. Though it is very minimal, which is more of cosmetic, but it gives you some level of protection, at least for maybe 15 to 10 to 20 minutes. So once you have shea butter available in Nigeria, you could start using that. Yeah, and probably there are so many ways. Now we are in the information age. You can just Google how to produce sunscreen on the internet. Probably you'll find something. Maybe if you're able to locate such chemicals, fine, you could follow the procedure and put it together. Though it's not so safe, but yeah, Mafalda could speak more on that. Probably maybe she may have a conference one day to teach us how to produce a simple sunscreen in our homes. That is a good recommendation. So I'm thinking Mafalda can take that up and then probably set up something like that for all of us, which is be very helpful that the person with albinism can just start not waiting on government, but start doing things by themselves and then protecting. It's very key to our own selves, which is very, very, very necessary for us to take. Thank you, Sarah.
Okay, yeah, thank you so much. Thank you for putting the disclaimer that people shouldn't just Google the chemicals and make it themselves, but they should, get the training and the education. I do think it's important, but it also does highlight this major gap that the countries are missing in their international obligations. People shouldn't have to do that, right? They should be able to get what they need from the state as per international obligations. Marvelous, maybe you can talk a little bit about, what have you done in Zimbabwe to support? I'm thinking about Nene's question here, that we are dying here, what do we do? So what have you done when you realized that people within your community are dying? What did you do, and what advice can you give to other CSOs in low resources settings of things that they can do to just be active? And as Kwame says, in a way, no one is coming to save you. So while you are waiting for advocacy to yield its fruits, what can you do in the meantime as a CSO?
Oh, okay. Thank you so much, Sarah. Can you hear me? Okay.
Yes,
so
we can hear you.
Okay, so for Nigeria, I can say I think they need more awareness, more educating us, them people with albinism, more in Nigeria, so that they know how to take care of their skins. Because skin cancer obviously is the sun for us. So we need to protect ourselves, take care of ourselves, because it's our body. No one will do that for us. And also the government should be involved, And then for Togo, I think on knowing if the product is good, we all have albinism, but it doesn't mean that our skin, we use the same product. As for me, maybe Nivea can do for me, but for someone it doesn't do. So I think we need to explore, use different products so that you can test which lotion can do for yourself. And then you find out, you use that one. So, and then as well, the government should make sure that it's involved. They need to involve the government so that the government maybe look at the sunscreen lotions to make sure if it's safe for them. And also we need to research, because these researches were done long back. Now the climate has changed. We need to research more and work with other organizations and work with the university, like what we are doing now, to create more some other lotions which are suitable for our current climate. And then as well for Nigeria as well, I was thinking that maybe they can also okay, I forgot the orchids. Right. So I was thinking that for Nigeria, they need to work more with other organizations, so that organizations will come together and help each other, not just thinking like our mindset, we know Africans, no, that organization is doing that. No, that organization, they took our people. We need to work together so that we can raise awareness, educate each other so that we know about our skin and we know how to protect our skin. Thank you.
Okay, thank you. And then I also wanted you to share what does Noble Hands Trust do to educate people with albinism, given that Zimbabwe is a very low resource setting? What are some of the platforms that you use to give education to people? Maybe you can share that, which can be useful for other CSOs.
My mic. Okay.
We can hear you.
Most of the times here in Zimbabwe, we use social media. We create WhatsApp groups for our people. Each province has got a WhatsApp group, and we've got coordinators, so that even when we are distributing sunscreen lotions, it won't be difficult for us because the coordinator will be knowing. In my province, I've got 50 people. I just give 50 people. If there is anyone, will be knowing. So we open WhatsApp groups. Where every Mondays, Wednesday, Fridays, or Sundays, we educate. We have time whereby we educate each other. If we have got any wound or anything that you don't understand about your skin, you just send to the group, guys, I've developed this. What can I do? Then we talk. Sometimes we invite specialists, doctors in the group to give us more advice on our skin, because sometimes people, they don't have data in the rural areas to Google about our skin or what. So sometimes we call the doctors on WhatsApp, they tell us. Sometimes we also do workshops whereby we go maybe in a province, we just come into one place, we start talking about our skin. So that's how we raise awareness. That's how we educate each other.
Thank you for that. And Mafalda, I see that you have been responding in the chat to some of the questions. So I think if anything you want to mention, even after you respond, please feel free to mention. I think there's an interesting question that was raised there about whether it's efficient to do local production or not. Maybe you can speak to that a bit. And maybe before you come in, Mafalda, I want to turn back to Muluka and Andrew. So there's a colleague here who says, on my trip to Republic of Congo, I was surprised by the involvement of different ministries such as social affairs, communication, and health for people with albinism, and the work of the AJCA Association. Perhaps we should work with these countries from where their governments give us support. So I don't know if, Muluka, you want to talk a little bit about what you've seen in terms of that. And then there's also just one more question, then you can both respond. How can we ensure that persons with albinism, once diagnosed as having skin cancer, that the government is responsible? And again, here, Muluka, you talked about those international obligations that governments have signed on to as a result of international treaties. So maybe, Muluka, you can start, and then Andrew, you can also come in with your viewpoints. And then after that, maybe Mafalda, you can talk a bit to some of the questions you've been answering around whether or not it's really efficient to do production locally.
Thank you, Sarah. I also want to just jump in and, if you permit, also respond to some of the other questions briefly. So there was a question on an international conference or summit on albinism and climate change. And as Kwame says, yes, it requires a lot of money, it requires funding. And in order to get that, we need interest from people, interest from funders and from donors who would be perhaps willing to fund this. And one of the challenges I found in doing the report on albinism and climate change was the lack of information, the lack of data. So we talk about albinism and the impact of climate change on persons with albinism, but the data was very low because no one is looking at it. No one is actually doing the research. And I think it's important that this research is done and that there's documenting. And this is where I'd also want to call on civil society organizations to provide some support. Of course, number one, it's the government's role to provide the data, but where the government is not providing data, it's also useful for organizations to do this. We don't have any statistics at the moment on the rate of albinism skin cancer in persons with albinism compared to the general population in most countries. However, I speak to organizations and they'll always say to me, so many people, we're dying, so many people have got skin cancer, and we need this information, even if it's just to say, in our membership, we have 50 people with albinism, and amongst those 50 people, 13 have been diagnosed with albinism, with skin cancer. That already provides some information. And I think if we can get lots of organizations from around the world to provide us with this data, this helps in the first step, like how do we raise interest, the research in that area. Nigeria, yes, I know this. Nene, nice to see you. Well, I can't see you, but to hear from you and to have read your question. And I know that this is a huge concern in Nigeria. And in fact, this is another call that I can ask for as well, in the sense that as part of my mandate as an independent expert, I have the responsibility to raise human rights violations, cases of concerns with the government. Most of the times, countries come to me, or individuals, organizations come to me with cases of killings, abductions, mutilations, which of course I want to hear about and I have the responsibility to respond to. I just want to highlight as well that it is not just those cases. So Nene came to me with a concern around skin cancer and persons with albinism in Nigeria dying of skin cancer. And I did a communication to the authorities, raised this concern, and reminded the authorities of their obligation to ensure the right of access to health. And it was not just done by me; it was also the Special Rapporteur on the Right to Health was included in this communication, and the Special Rapporteur on the Right of Persons with Disabilities. Of course, on the one hand, you may say, well, nothing has happened since then, which is true, unfortunately. But at the same time, we now have something reminding the government, which can also be used in advocacy to say, it's not just us who are saying it, but these independent experts, these mandate holders have also said it. And so can you, do something about this? And I think it would have helped as well in my research if I had had more of these kind of communications to say, these concerns of skin cancer amongst persons with albinism have officially been raised with this government and that government and that government. So please don't hesitate to raise these questions with me, these concerns with me, so that I can raise them with the authorities as well. I think that's important as well. And then there was a question, sorry, the question that you actually initially asked me before I went to past questions.
I think there was a question on how can we ensure that it becomes the concern of the government once a person is diagnosed with skin cancer. And then there was another question about different ministries coming together, working together. Yes, and I don't know if AGCA Association is familiar to you. That was
an association, yeah. So again, I want to highlight the National Action. Well, first of all, before I highlight National Action Plans, I want to highlight the AU Plan of Action on the elimination of attacks against persons with albinism. And I know the title adds attacks, but this is a very holistic plan of action. It also looks at issues around health, education, and a number of other employment as well. It is a multi-sectorial plan of action. It's also interministerial plan of action, developed to be an interministerial plan of action. And the plan of action was adopted by the African Union, therefore the governments of Africa. And it's not a binding document as such, but this is an aspiration, and this is the document that is being used to produce national action plans. So we have countries, Malawi, Mozambique, Angola was a recent addition to the national, adopting national action plans. Uganda adopted a national action plan. These are plans which state which ministries can be involved and how the ministries can be involved, and what their roles are in relation to persons with albinism. And as I said, they're holistic. So I would definitely recommend, if we want to have this where more governments are involved in the concerns of persons with albinism, let's adopt a national action plan. And it's not hard to do because we already have the AU Plan of Action as a template on which to do this. AAN, the African Albinism Network, they do a lot of work around this. Speak to them, get some advice if you're in a country that does not have a national action plan. I know countries, South Africa is in the process of developing one. Tanzania said they're in the process of developing one. So let's have a holistic approach. Let's look at the AU Plan of Action and use this. And I've actually used it because I think it's a very good practice. And I've used this even in my recent visit to Panama, where they have a law on albinism, but they now need to have guidelines to implement it. And I recommended to Panama to look at that, even though there are no attacks in Panama. The other concerns of discrimination, health, education, still applicable. So yes, let's use the plan of action, the AU Plan of Action on albinism as well to develop national action plans. And maybe practically, look for, speak as an organization, speak as one voice if you can, because that's the other problem where albinism organizations are competing against each other and having different messages when they go before the authorities. It makes it hard to get an agreement from the authorities if they say, well, this organization was here last week and they wanted this, and now you've come and you want something else, and this organization said one thing and you're saying another thing. So try and speak with a united voice when it comes to the development of a national action plan. Try and put aside your differences and seek this kind of mutual ground, and then look for allies within government, be it ministers, be it the president's wife, because in some cases it is the first lady who actually can be the champion for you. But look for those champions, speak to people, look for champions, and suggest a national action plan, which shouldn't be too scary because it's been adopted by the AU already. So it shouldn't be too scary for national level. Thank you.
Thanks so much, Muluka. So because of our time, I'm going to give the rest of the panelists time to just give your last thoughts. Mafalda, I'll start with you, and then Marvelous, if you have any last thoughts you want to share, just 2 minutes each, and then Kwame, you can close us off. So over to you, Mafalda.
Yes, thank you very much. So I think we have covered a lot of aspects here in the panel. I think the conversation could continue further and longer. But first, like one of the reflections that to me is coming up is like the need of continue with the awareness, with advocacy in front of governments, institutions, because, and going back to the sunscreen, even if it's to import sunscreen, to manufacture locally, you need to import ingredients or import sunscreens. So the issue of the customs, of the tax exemption, it's very important. Also, and it's also relating to what we are doing. We have developed a low-cost, high-quality sunscreen that we are distributing in some countries and assisting to establish the production unit, but also the coordination in the distribution. Like it doesn't help to just to do a one-shot donation and then there is not a proper channel of distribution, educating to the users, to the community, so that is also very important, either done by civil society organization or once again continue the advocacy with the government. That's always going to the same, not to the importance of like bringing in the institution for long-term solutions. And the last part is, and it's also going back to our starting point, is to work towards having a high quality product that are used that really making a difference.
Thank you. Marvelous, any final words?
Thank you so much, Sarah. Also, I was saying that I think working together as organizations, as Madam Muluka said, it will make our voice big. It will be better for us to be heard. And also sharing opportunities, sharing links of grants, sharing, even if there is a training that you heard about the sunscreen lotions. I think if we link each other on those ones, I think it will be, we'll be on a better place as people who are helping our brothers and sisters with albinism. That's all I can say. Thank you.
Andrew?
Thank you, Sarah, and thank you everyone for all these conversations. Yeah, I think I have to echo Mafalda's word that this conversation could continue longer and further, but the time is of essence. But for my last comment, I just want to recommend to our colleagues that the advocacy must continue, and probably the challenge of how to do this. And African Albinism Network, we have identified that we find it difficult to do the advocacy on the ground, especially using UN recommendations or AU recommendations in documents produced by Muluka or other UN human rights mechanism. So we take the initiative of turning this UN recommendation into simple toolkits in simple languages that you can look at and see if the UN says, okay, say Muluka recommended that the government must provide sunscreens for persons with albinism. How do we use that? Who do you approach? Yeah, you can find all that in a simple document that we call mini toolkit on our website at africanalbinismnetwork.org. When you go to that website, you'll be able to find these toolkits on various thematic areas that can help you to approach your governments with maybe a simple letter or simple walking to the office to meet these individuals. No, let's not be afraid that these are government officials, so they are big men. No, like that's big manism. We should take it off. They are just human, just like us. We can just sit and have a discussion with them one-on-one, and they should be able to understand the issue. So just hook onto our website and then get hold on to these mini toolkits, and they will be able to guide you as to who you can approach, how you're going to approach these individuals, and what they're going to be saying to these individuals or government officials to be able to understand the situation on the ground. And this way we'll be able to see impacts, though it may not be immediate, but gradually we'll be able to make that important step to ensuring that our rights are protected. Thank you, sir.
Thank you so much, Andrew. And thank you also to our guests for sharing their experiences, for sharing their knowledge. I think hopefully what our participants have also learned is there is a resource organization you can go to if you need a toolkit to be able to do some advocacy in your country. That's Africa Albinism Network. There are people like Mafalda and Beyond Suncare who are working to see how we can have affordable products that are necessary to support the health of persons with albinism. There are partner CSOs that can give you some ideas how to operate in a resource-constrained environment. How do I build alliance? How do we build support groups for persons with albinism so we can share information? And most importantly, there's a global advocate in the Office of the UN Independent Expert. And that's someone that you can access, you can write to, and is available to support you. So my hope is, in the spirit of what Kwame said, even if you're not invited, present yourself there and make your case, and that, as organizations supporting the human rights of persons with albinism, we can continue to speak up, we can continue to advocate, we can continue to knock at the door until there's inclusion for us and our issues, and there's inclusion for the health concerns and the life concerns of persons with albinism so that they can also live lives of dignity. So thank you to everybody for joining us, and wish you all the best.